My name is Savannah Francis, and this is my computational thinking project on the dataset health. So to begin my project, I decided to look at the history and background of various vaccinations of the diseases that are in my dataset. I did this because I thought this information would be interesting when I went to look at years with decreased disease rates. I wanted to know if maybe the vaccination had started that year or something. This is the map of my dataset. The set starts with the list of health, which is a list that contains 1,000 elements or dictionaries, all labeled indexes. Each index includes 6 elements, which are disease, LOC or location, number, population, year, and increase. Disease and location are both strings, and number, population, year, and increase are integers or floats. This data is useful because it describes the following properties. This data looks at LOC or location representing the geographic location of the instances of diseases, disease representing the actual disease itself, number representing the total cases of a disease in a certain year and place, population representing the number of people in a specific location, increase representing the number of cases of disease per 100,000 people, and year representing the year that this particular disease was present. The questions that I decided to answer with my project were: how has there been a change in population over the years been correlated with an increase in disease rates for smallpox, hepatitis A, pertussis, mumps, measles, rubella, and polio? How have the rates of polio, mumps, rubella, and pertussis changed over the years in Virginia, and which disease was most prevalent in 2011? Is there a difference in the instances of mumps in Virginia and in its bordering states over the years? And is there a difference in the rates of smallpox in Virginia and Louisiana over the years? I organized my project by beginning to look at the data to see if there were any trends in the rates of diseases over the years as the population increased. And after seeing this trend, I decided to see how the rates of various diseases in Virginia occurred over the years. And after seeing these trends, I decided to look at 2 specific diseases and their instances in various locations in comparison to Virginia. Some limitations in my dataset are that there are gaps in the data presented. Not all diseases are reported every year, and there are no ages or genders of those impacted. Also, it's not easy to know the geographic location northeast, south, or west of the diseases, and no information on vaccinations or lack of vaccinations is given in the dataset. The stakeholders for this dataset are epidemiologists, government agencies such as the Center for Disease Control, historians, medical professionals like doctors and nurses, and the general public. My first question is: has a change in population over the years been correlated with an increase in disease rates for smallpox, hepatitis A, pertussis, mumps, measles, rubella, and polio? As you can see from this chart, the population has steadily increased in Virginia since the late 1920s. However, even with an increase in population, the number of cases of diseases has plateaued at an all-time low. This information is important for the stakeholders because it allows epidemiologists and the CDC to see the general downward trend of disease rates. It also allows historians to understand the past history of disease outbreaks. How have the rates of infection with mumps, polio, pertussis, and rubella changed in Virginia over the years? Pertussis has had the highest rates of cases in the mid-1940s. Although the disease has had many fluctuations in numbers, it has had a fairly consistent downward trend. This could be correlated with the vaccination, which began in 1939. In the late 1950s, the disease saw an increase one more time before plateauing. In the mid to late 2000s, there was an increase in cases. Polio had the largest number or rate of cases in the early 1950s. After the 1960s, there is no data on the disease in Virginia. This could be due because the polio vaccination was administered in 1960. Rubella spiked in cases about a year before the mumps did. The mumps had a small spike in the late 1980s to the 1990s. Both diseases have since plateaued at an all-time low. This information is important. For example, in the mid-2000s, there was a spike in pertussis. According to the CDC, in 2004 and 2005, there was an increase in the number of pertussis cases. Stakeholders such as the CDC need to watch the trends of diseases in order to educate the public and hopefully prevent future outbreaks. Is there a difference in the instances of mumps in Virginia and its bordering states over the years? This graph indicates that North Carolina has consistently had a lower rate of mumps than other bordering states. Virginia has also been consistently one of the states with the lowest rate of cases of mumps. Around 1967, Tennessee had a significantly higher rate of mumps than any other locations. Tennessee, West Virginia, and Kentucky all had high rates of the mumps around 1973 and 1974, with West Virginia seeing significantly higher rates of cases than any other state from 1965 to 1976. However, after 1974, Tennessee, Kentucky, and West Virginia all saw a decrease in mumps cases. West Virginia has continued to have a decreased rate of the mumps. Between 1980 and 1985, none of the locations had many cases of the mumps, and in 1986, Tennessee saw an increase in cases, and in 1988, Maryland saw its highest rate of mumps cases. Also, since 1990, none of the locations have had many cases of the mumps. This data is valuable because it allows stakeholders to see how few cases of mumps exist in comparison to years past. It is also interesting information for historians and epidemiologists because they are now able to see that states like West Virginia, Tennessee, and Kentucky that have had historically higher rates of the mumps. The last question I decided to address was, is there a difference in the rates of smallpox in Virginia and Louisiana over the years? The rate of smallpox in Louisiana has consistently stayed higher than the rate of smallpox in Virginia. Louisiana had a spike in the smallpox in the mid-1920s and then again in the early to mid-1930s. Virginia had a small increase in smallpox around 1928 to 1929. From 1935 on, though, both states have seen very few cases of smallpox. A fun fact I learned while researching the smallpox vaccination, according to vaccinationhistory.org, the smallpox vaccination is the only vaccination that has effectively eradicated a disease. This information is valuable because it allows the stakeholders to see that the history of the effect of smallpox, allowing them to understand the impact the vaccination has had. My conclusions are that pertussis has had a relatively high rate of infection until the 1950s. The mumps and rubella follow similar trends in infection rates over the years. With an increase in population, disease rates have plateaued at an all-time low. This can be related to an increased access to vaccinations over the years. West Virginia, Kentucky, and Tennessee have generally high rates of the mumps. North Carolina has a generally low rate of the mumps, and mumps have decreased significantly since the early 1990s. This data indicates that even though mumps still exist, it's not as much of a threat to humans as it was 40 years ago. Louisiana has consistently had a higher rate of smallpox than Virginia. This information would be useful to epidemiologists trying to understand the trends of smallpox in different areas of the United States. I would like to acknowledge Dr. Kafora, Corey Bart, and Nick Kolob for their help on my project. And here are my references.